Are you tired of battling back pain or leg pain with no end in sight? Are you wondering if spinal decompression is truly the miracle it's claimed to be? You're not alone. But what if I told you there's one crucial element missing from almost every spinal decompression treatment out there? An element that could fast track your healing, deliver immediate relief, and provide lasting stability. In this video, I'm going to demystify spinal decompression therapy once and for all. You'll learn everything you need to know to make an informed decision about your treatment, and I'll reveal the missing piece that could make all the difference in your recovery. Spinal decompression has been hailed as a non-surgical solution for a variety of back issues like disc bulges, disc herniations, lumbar stenosis, pinched nerves, and radiculopathy, but there's a lot of confusion surrounding it. How effective is it really? Is it safe for you, especially if you've had previous spinal surgeries or conditions like disc herniations or stenosis? And most importantly, how does it stack up against surgical options? This video doesn't just answer these questions, it gives you the insider knowledge all in one place, including a breakthrough treatment combination that could accelerate your recovery like never before. With over 30 years of experience in spinal care and a track record of helping thousands of patients achieve long-term pain relief, I've seen firsthand what works and what doesn't. This isn't just another video repeating the same old information. I'm bringing you insights based on real patient outcomes, the latest research, and cutting-edge treatments that you won't find anywhere else. Plus, I'll be sharing exclusive patient stories and case studies that prove the power of this approach. By the end of this video, you'll have a complete understanding of non-surgical spinal decompression therapy. But more importantly, you'll discover the one key treatment that's often missing, something that when combined with true spinal decompression, and I'll explain what true means, can provide immediate pain relief, speed up your healing process, and ensure long-term stability and long-term solutions. Stay with me to the end, and I'll give you access to my exclusive Health Vault, a collection of lifestyle and wellness videos that will support your journey to a pain-free life. Plus, I'll introduce you to a revolutionary spinal decompression treatment available in only 12 locations worldwide, including right here in Ottawa, Ontario. This could be the game changer you've been searching for. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs or surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. To help you fully understand non-surgical spinal decompression and what it can do for you, I've put together the 12 most important things you need to know before starting therapy. By walking you through these key points, I'll ensure you have all the information necessary to make a confident decision about your treatment and take the next step towards lasting relief. Let's dive into these essential questions together. So question number one in our 12 questions, probably the most important one, is how does non-surgical spinal decompression work? So understand what I'm talking about is what's called non-surgical spinal decompression. You'll often hear the term spinal decompression, and that can often be a surgical term where they go in and try to take pressure off those areas, but that is an invasive technique that does have its risks and its side effects for sure. What I'm talking about in terms of non-surgical spinal decompression is, remember, your vertebrae look like this. So you've got a vertebrae, you should have a nice thick disc, another vertebrae, there'd be another disc, another vertebrae. The yellow guys coming off, those are the nerves, and they come right off the spinal cord. Unfortunately, a lot of people don't look like that. What they look like is they look like this, where that vertebrae may have thinned out. So when I say thinned out, that can become advanced, and that's what we refer to as advanced degenerative disc disease or osteoarthritis. You can have the disc bulge, where the disc itself bulges or herniates. You can have spinal stenosis. You can have spondylolisthesis. All these things are putting pressure on the nerve. So what non-surgical spinal decompression is what makes more sense than to take the pressure off the nerve. Right? That's what non-surgical spinal decompression is all about. It is not traction. Right? It is not being on an inversion table. There are some people who still believe that. Please run for the doors. That's not true. It's a very simple Google search. Spinal decompression was actually invented by a guy by the name of Dr. Alan Dyer, PhD, MD, former Minister of Health for Ontario, so very much a Canadian thing. And what happens in true spinal decompression, so true spinal decompression is you're actually getting that decompressive effect. Traction will stretch you. Inversion tables, I have one in my own gym, will stretch you. They can be beneficial. But true spinal decompression literally creates that vacuum effect that's going to pull nutrients and fluids back into the disc. It rehydrates the disc. It can actually allow disc herniations and bulges to recede. It helps with stenosis. The goal is to give you long-lasting results by actually helping to fix the underlying cause of the problem. Question number 2, then, what conditions can be treated with spinal decompression? Well, I've just mentioned some of them already. So obviously, anything that's putting pressure on the nerve or compressing that disc can be treated with spinal decompression. So that's going to be anything from pinched nerves, radiculopathy, sciatica, spinal stenosis, degenerative disc disease or osteoarthritis, disc herniations, and disc bulges. Question number 3, is spinal decompression therapy painful? It should not be at all, especially in our system. You're going to be lying flat and actually relax. And now that's up to the skill of the doctor who's putting you on there and setting the technical factors. This is not something that we're putting you, as I say, on the medieval rack and pulling as hard as you can. That's a skill set that comes from the doctor who's done the proper exam, where we set the technical factors. So that's going to be everything, from what amount of decompression tension, what time intervals, et cetera, et cetera. Number 4, am I suitable for non-surgical spinal decompression if I have pre-existing conditions like spinal stenosis, spondylolisthesis, or disc herniations? Almost absolutely yes, it's exactly what those treat, but the key point here is you need to do a comprehensive exam first. That's one of the cornerstones. So what I do in my clinic is just as important as any spinal decompression is that you've actually identified all of the underlying causes. But that's exactly, you need an expert to actually determine that for you. And one of the ways that you'll know whether spinal decompression is actually working or not is it helping you? That's one of the ways. If you've been doing simple basic traction or inversion and you're not getting anywhere, this may be one of the reasons why. Question number 5, who's not a good candidate for spinal decompression? Well, there's going to be two main things. Number 1 is you have to be motivated. There are some people who have been living with their pain for so long, and it's understandable that they believe there's no hope for them. But if you're not willing to make the effort, and if you don't feel that you can get better, you're not going to get better. As far as condition-wise, is there are certain conditions that do make you ineligible for spinal decompression. So obviously, any pregnant woman, we would not be doing spinal decompression on the lumbar spine. You've got to be careful with active cancers. You have to be careful with severe osteoporosis or any fracture, obviously, in the bone as well. Those are all the things that we're looking for. Even for previous surgery, often we can help those people, but again, that's a case-by-case basis. Number 6, how many sessions are needed to see results? So, this is interesting. And this comes actually with maybe some additional questions. Will you see immediate relief after just one session? Does it take several sessions, to notice improvement? Understand what we're doing in spinal decompression is we're getting the body to change. So some people can see a benefit after just one session, but it's the body responding to what we're doing. Remember, spinal decompression is pulling nutrients and fluids back into the disc. It's actually rehydrating the disc, and then the spine and the body and the nervous system have to respond to that. So one of the best analogies, if you're weightlifting, you don't do one bicep curl and expect the muscle to bulge out. It's the 3, 4, 5, 6 days later when the body repairs what you've done in that weightlifting move. When it comes to spinal decompression, that can take longer than that because we're trying to get the body to change from what it may have been suffering with for 5, 10, 15, 20 years. Question number 7, how does non-surgical spinal decompression compare with surgical options for treating spinal conditions? Hands down, far more effective in terms of non-surgical spinal decompression with what we see in our clinic. A recent study out of the Journal of Pain showed that people who undergo surgery actually had a 74% failure rate. 74%, with 1 in 3 of those people actually back in the hospital within 30 days. All depends what type of surgery is done, how it's performed. but certainly there's going to be a lot more possibility for adverse reactions, for risk, for recovery, and so forth. That's one of the main reasons why non-surgical spinal decompression was invented in the first place. Question 8, what can you expect during a spinal decompression session? Well, if you're in our clinic, you're going to find actually incredibly relaxing. You get to lie flat on your back in most cases. You'll be fitted into our system, and then you're going to be on, lights off, music on, music off, door open, door closed. Most people actually find it a very relaxing time. It should not cause you any pain. It should not cause you any discomfort whatsoever. We've given thousands of successful treatments without any serious adverse reactions of any kind. Number 9, how long do the results of spinal decompression last? So again, that's one of the things that we really try to do is we're not looking to give you a patch job. We're not looking for temporary relief. There are many forms of care that are very well-meaning, and their goal is to help you as much as they can. But in a lot of cases, the results are temporary. And one of the reasons that happens is a couple of different things. Number 1 is they're not addressing all of the underlying causes. Number 2 is they're giving you something that will help you temporarily, but if you're not addressing the underlying cause, you're not going to get the long-lasting results. Spinal decompression is designed to actually give you those long-lasting results, especially when you combine them with all the other steps that we do in our clinic. The goal is to actually fix the underlying causes of the problem. Question number 10, can spinal decompression therapy be combined with other treatments? And the answer is yes. In fact, in our clinic, it's essential that they're combined with other treatments as well. We want to address all those factors. If you're getting those treatments elsewhere, we just need to be sure that they are things that are beneficial to you. Obviously, the more things you do that are healthy for you, the healthier that you're going to get. Question number 11, is spinal decompression safe for someone who's undergone previous spinal surgeries? So we touched on this in one of the previous questions a little bit. In most cases, yes, but this is really a case-by-case basis. One of the things is sometimes people will disqualify themselves from spinal decompression when they really shouldn't, especially, again, if you're going to a doctor who's an expert in the field, is, if you've had previous spinal fusion, you would think, well, hold on, we can never pull those vertebrae apart again. And you're absolutely right. I can't pull apart vertebrae that have been fused together. But if you've only had that fusion at one segment, we definitely want to address the other vertebrae above and the other vertebrae below as well. If you've been fused through 5 different segments, obviously that's a different thing. We're never going to be able to separate those. There's a lot of misleading information out there as well. There are still some credible websites who believe, for instance, for spondylolisthesis, so that's when the vertebrae have literally shifted on one another, who believe that you should not be doing spinal decompression. I couldn't tell you how wrong that is. We have case after case after case, pre and post x-rays where we actually help, we actually correct, in some cases fully correct, and a number of cases partially correct, spondylolisthesis. So no surgery, do not be scared if you've had previous surgery. There is something called failed back surgery. We have a number of patients who've had previous surgery who see great success with us even after the surgery was a failure. And then question number 12, what are the potential side effects or risks associated with spinal decompression therapy? Again, we've touched on this in one of the previous questions. We have had 0 serious adverse reactions after thousands of treatments, but there can be risks depending on where you're at. So again, this is where the exam becomes so important. We try to rule these out. That's why our safety record is so great. But again, if you were someone with severe osteoporosis, I'm not going to pull on something that could actually break on someone blowing on it, type of thing. What you're looking for is we rule those out, and you set technical factors to what we know the spine can handle and so forth. So minimal to 0 risks. Nothing is ever 0 risk, but it's something where we minimize all those, and our safety record speaks for that as well. Now, with these 12 questions answered, you now have a definitive guide on non-surgical spinal decompression. We've established that the treatment is highly effective for conditions like disc bulges, disc herniations, stenosis, sciatica. It's also safe. It's a non-invasive alternative to back surgery. It offers many patients the chance to avoid surgical interventions altogether. However, there's one key element still missing from most treatments. Some still don't see the results they're looking for because when spinal decompression happens, the spine may resist or it may want to go back to its original state. And that's exactly why non-surgical robotic laser spinal decompression was invented. That's the combined use of class 4 laser therapy actually simultaneously and during the spinal decompression process. This powerful combination not only enhances safety and effectiveness, but it also speeds up pain relief, promotes long-term healing. It may even prevent the need for back surgery. So what exactly does class 4 laser therapy do? Well, class 4 laser therapy is a powerful treatment modality for accelerating tissue healing and reducing inflammation. It works by penetrating deep into the tissues, promoting cellular repair. It enhances blood flow to the affected area. For back conditions such as disc bulges and disc herniations, this therapy significantly speeds up the healing process. It stimulates the production of collagen, which is key for disc repair, and the regeneration of damaged tissues, which is essential for long-term recovery. So that's the unique advantage, is while some clinics may offer class 4 laser therapy and spinal decompression separately, very few combine it simultaneously. You want both treatments happening at the exact same time. That allows that, when you have the spinal decompression, that allows the laser to penetrate deeper. When the laser penetrates deeper, it allows for better spinal decompression. They work hand in hand very, very nicely. This is where non-surgical spinal laser, non-surgical robotic laser spinal decompression, the system sets itself apart. Okay? The advanced technology not only performs spinal decompression, but also integrates the class 4 laser therapy at the exact same time, targeting the exact areas that need healing as the decompression takes place. It's the combination that is exceptionally effective because the decompression, as we said, creates space in the spine. It allows the laser to penetrate even deeper into the tissue, providing immediate pain relief. It relaxes muscles, it speeds up the healing process, and it helps to ensure long-term stability of the spine. Patients sometimes report feeling relief from the first session, and the combined approach drastically reduces the time needed for recovery. There are only 12 of these non-surgical robotic laser spinal decompression systems in the world, and I'm proud to say that we have the only one in Ottawa, Ontario, Canada. We've had people drive 5 to 10 hours away just to come to our clinic for care. The technology is not just effective, it's safe, it feels good during treatment, and it delivers results that simply can't be achieved with traditional methods. By leveraging the cutting-edge combination of non-surgical spinal decompression and class 4 laser therapy, which is the highest level of laser approved by Health Canada and the FDA, you can experience quicker, more effective relief for your back pain with a much higher likelihood of long-term success. This is exactly what Richard experienced. Richard is an 8th degree black belt karate instructor who presented with chronic low back pain. He'd been suffering for years. He had tried many other forms of care with limited success. After our specialized comprehensive consultation and examination, we determined that Richard had more than one underlying cause of his pain. Richard had advanced degenerative disc disease, he had chronic multiple subluxations, he had spondylolisthesis, he had a scoliosis. You can see with complex conditions, the treatment program must also be comprehensive. Failure to do so is one of the many reasons why people still continue to suffer needlessly. We provide a 7-step multimodal treatment program for patients. At the end of the video, I'll share a link that outlines in detail my 7-step treatment program. The cornerstone of the multimodal program is including non-surgical robotic laser spinal decompression. Sensei Richard, after going through our program, now estimates that functionally he is 15 years younger, and he can now do things in the dojo that he hasn't been able to do in years. Our second case study is Siba. Siba is a 48-year-old female who suffered with significant chronic neck pain and dysfunction as well as upper back issues. She was very disillusioned with her healthcare system and had tried many things and given up on many other forms of care. After a specialized comprehensive consultation and examination, we determined that Siba had multiple underlying causes of her pain. She had advanced degenerative disc disease, disc herniations, scoliosis, anterior head syndrome, multiple chronic subluxations, and multiple levels of spondylolisthesis. Again, you can see that with complex conditions, the treatment program must also be comprehensive. Failure to do so is why many people, including Siba, continue to suffer needlessly before coming to our clinic. Siba was under a significant time crunch as she was leaving the country to go overseas, so she was placed on an intensive 2-week neurospinal restoration program where she was seen 2 to 3 times a day, including non-surgical robotic laser spinal decompression and our signature 7-step approach. Siba is thrilled with her results, including a significantly improved nerve scan, complete reversal and resolution of her spondylolisthesis, as proven by our pre and post x-rays. And for our third and final case study today, let's talk about Kathy, an 83-year-old woman who suffered with serious chronic low back pain and sciatica, who had to use a walker at all times, and she was referred to us by her doctor in the US. After our specialized comprehensive consultation and examination, we determined that Kathy had more than one underlying cause of her pain. They always do. It's never just one cause, and if you don't identify all the causes, how on earth do you ever fix it? Kathy had advanced degenerative disc disease, severe subluxations, a major pelvic dysfunction, scoliosis. These are things that all need to be addressed. So again, you can see that with complex conditions, the treatment program must also be comprehensive. Kathy completed her 8-week neurospinal restoration program 3 times a week, including non-surgical robotic laser spinal decompression and our 7-step program. Are you ready for this? Kathy has seen significant improvements in pain levels and function. Most importantly, she no longer uses her walker. And when she does use a cane, she's usually holding it up in her hands and it's never touching the floor. The rest of the seniors wants to know her secret, which she's all too happy to share. You now have a comprehensive and definitive guide to non-surgical spinal decompression, along with insights into laser therapy, the key element that can enhance the results. Put them together simultaneously and you have non-surgical robotic laser spinal decompression. If you ever need to revisit any of these key points, this video will always be here as a resource for you. Feel free to come back and review the information to ensure that you're fully informed every step of the way. Remember, if you're struggling with serious back pain or leg pain and feel like you've tried everything, don't give up. That's exactly how most of our patients feel when they first stepped into the clinic. They were ready to give up. This innovative treatment, non-surgical robotic laser spinal decompression, could be your answer to getting your life back. Seek out non-surgical robotic laser spinal decompression. It's safe, it feels great, it delivers real results. If you need help finding a doctor who offers this treatment, just comment below and we'll assist you. As I said, there are only 12 of these systems in the world. We are the only one in Ottawa, Ontario, Canada. If you're willing to travel, as many of our patients do, we'll be here for you. Remember, you don't have to live with pain. There's hope, and you can achieve and reclaim your normal life. As promised, check out the link in the pinned comment below for free access to the Health Vault, a collection of videos designed to support your journey to better health. And please don't forget to like and share the video if you found it valuable. There are people suffering with things that they don't need to suffer with. They just don't know, and it's not their fault. Remember to subscribe for more insights and strategies on relieving back and neck pain naturally without the need for drugs or surgery. And be sure to watch the next video where I outline a detailed 7-step non-surgical treatment protocol for disc bulges, disc herniations, stenosis, and other degenerative spinal conditions. Please go watch the video next.